A minute on to the hour of 9 o'clock. Good morning to you, Grenada, Carriacou, Petite Martinique, the rest of the Eastern Caribbean, to you wherever you are. It's a wonderful, really, really wonderful Tuesday morning, and you don't have to believe me. You just have to wake up and smell the coffee. And the fact that you are within the range of my voice is enough reason to be grateful and say thank you, Jesus, for holding me in your arms, keeping me through the night. Good morning again to all our listeners, those of you on GBN Television, Channel 7, Channel 11, Channel 20 if you're in cable. Those of you that's following us via Classic Radio 105.5 or 105.9. And certainly we say a special good morning to you, those of you in the diaspora. Depending on where you are, we say good morning, good afternoon, good evening. But thanks for being part of the Classic family. And we also shout at those of you that's following us via YouTube and via our Facebook feed. Thank you and welcome to this another episode of To The Point. For this, the 10th day of the month of January. Yes, you heard me, the 10th day. We're seeing when the scenes go matching on, or when January goes. But the good thing with the speed at which January is going, you don't get a chance to realize how long we normally perceive that it is. But either way, I want to say thanks for being part of the conversation. And I certainly want to say thanks to my two wonderful guests that is with me this morning. And it certainly would be remiss of me if I don't again officially extend a Happy New Year to you two wonderful people. And David Añtoine and Dr. Bert Braithwaite. Good morning, Madam.
Good morning.
Sir.
Good morning to you.
Good to be here, and thank you and for the good wishes, and we hope that your year will be a wonderful one.
Trust me,
and a healthy one.
I haven't had all the plans all figured out as yet, but in my head, I'm sailing smoothly.
Good.
I'm sailing smoothly. Well, how was the holidays though, otherwise?
Oh, pretty good. But, you know, you're always concerned about other people's welfare, and we know at this time there are a lot of people who are distressed in the society for one reason or another. You mentioned COVID, and there are other things. Yeah.
Doc, what did you keep away from specifically for the holidays?
I tried my best to keep away from any bug that is out there. and did anything I did it in limited amounts.
And I very often say to people, our concern is that while there's some things you have to keep away from, but very often it's understanding the whole principle of moderation.
Yeah.
And very often we can't wrap our minds around it. Mm-hmm. That we think everything we have to do in excess, but fortunately. I did say this morning that we won't be having one of those sexy conversations. And I know why. Because very often, if I say let's talk politics, brang or melee, but a phone line would kick up in 2 minutes.
Well, we're not totally away from politics. We are health professionals, but we are here on behalf of the New National Party, the opposition party at this time.
Excellent. COVID-19. We're just going to jump headfirst into it. We had our dose of it. We went through this 2019, the last 2 years, 2021, 2022, 21, then came 22. Here we are, 2023, and we seem as though coming off of 2022, we are breathing a fresh air of relief. But here we are in a new year, and we keep following what's happening in China and other parts of the Caribbean, in the U.S. They're getting worried that, are we going back? What if? And there's a lot of questions being asked out there, Dr. Bert. Let's give us an appreciation as to what's happening, specifically from the medical field, as it relates to COVID-19.
Yeah. Okay, just to say again, good morning to all your viewers and listeners, and wishing them all the best for the new year, and all the blessings. Yes, unfortunately, we would like to think that COVID has left us or is on its way out, but it is still lingering around, and it's still rearing its ugly head, and we have to be cognizant of that and act appropriately. In the United States, I think that's where our biggest threat can come from. There's this XXB15 that has emerged, and it's the rates of growth in many parts, especially of northeast United States, a part of the United States that we have a lot of contact with. That's going rapidly, and the virus is even more transmissible than Omicron, and we know how many people came down with Omicron. So we can anticipate that we are going to see a surge sometime in the first quarter of this year. We will see a surge of COVID cases here. And the question is, what do we do about it? Well, for the younger folk, by and large, they would have been exposed to Omicron before and the COVID in some form or fashion, either through vaccination or through having acquired it. And they should take care, because more especially they can bring it to the elder folk at home. But for the older folk, this is where we have to be particularly wary as at present. We don't know what the story of this new variant in the coming from the U.S. is not all clear at present, but certainly the elderly population is vulnerable. So we're saying all over 65-year-olds, if you've not had COVID during the last 6 months or so, and you've not been vaccinated, or even if you had vaccinations before, many people had, I think we had something like 40% or there, around close to 40% of the population that was fully vaccinated, but that's a year or two ago. That's a long time that immunity would have been. So if you're over 65, if you have medical issues, if you're significantly overweight, if you diabetic, hypertensive, if you have cancer, if you're a cancer sufferer, you're on chemotherapy, go get a booster. Now, I'm hoping, and this is one of my peeves, that we can get the bivalent vaccine. I've been asking around for both in the private and public sector now for a number of weeks, and can't hear that we are bringing it in. The bivalent vaccine is an advance on the original vaccine in that it looks specifically at Omicron, not specifically for this new variant, but it will work. The thinking is that it will work better against this new variant than the older vaccine. Of course, if you can't get the bivalent, you get any vaccine. But in the United States, if you just go into Walmart and you can go and get the vaccine, right? You have to pay for it. So I see no reason why we cannot have the bivalent vaccine. That's the latest version of vaccine available here. For all those, you're not forcing anybody to take it. I want to make that clear.
Right.
But if you are over 65, the advice would be to go up and get it. I cannot wait to get it. I've been trying to get hold of it. I traveled and I tried, but where it wasn't available.
Right.
So that's one of the first moves.
Lady Añtoine, Dr. Braithwaite, he's speaking truth to power, or he's just blowing this thing out of proportion?
No, of course not. In fact, I am really concerned that people are getting nonchalant about the whole thing, and people are thinking, oh yes, well, it's over, and so we can just do as we like. But they always have to be concerned, because it's not only about bringing it home to people like me who are within that age group and so on, but also you can be out in the supermarket, you can be out in a party, you can be taking your grandmother to church, and all of those areas are things that can happen. So we strongly want to recommend and to encourage the Ministry of Health and the powers that be at present, who are obviously the administration at the moment, to keep encouraging people to make the vaccines available to all and sundry, so that people can have make the right decisions.
But we find ourselves doing a quagmire.
And to encourage people to go and take it, right? Because the vaccines are there in the health center.
Right.
But you need to keep reinforcing the program, the educational program needs
And that's
to
the point I was saying, the quagmire that we find ourselves in. And because of that hesitancy that we've had, and the history is there, we're not even going to get it as to whether it exists or not. And many have always argued, the question has to be that of enforcement, not necessarily banging on the head, but a program that speaks to educating people. Ms. Añtoine, what say you?
Well, yes, I strongly agree with that, and that is what we would want to encourage all the time. I don't think we should ever stop talking about COVID. In fact, almost every day, there should be something being said about COVID and encouraging people to go forward at all ages and at all stages. Not because you're not thought to be in the vulnerable group, because there are a lot of people out there with kidney issues. I know we have mentioned cancer and those other things, but there are lots of people within that age group that have kidney problems, and dialysis and all of those things are obviously terribly expensive and so on. So to get another condition on top of that, you're really putting a nail in your coffin.
Do you think very often, and because I know there are persons though there who they're very myopic when it comes to certain issues. And interestingly, in a small society, everything becomes a question of politics. Who's the message coming from? But I'm assuming this conversation that we have in here is not one that is limited to the New National Party,
No,
but it
it's
should
not.
transcend across all platoras, all spheres, churches, NGOs. This should be a national conversation, Dr. Bert?
Absolutely, absolutely. This health in this can reach any person. As a matter of fact, I was on a program, and a young person, 30s, the father called in, young person, 30, no underlying factors, and came down with the most likely the person was calling from the United States, or messaging from the United States. Most likely would be the said variant, the XXB, and that person was desperately ill, and Paxlovid, the antiviral tablet, helped to pull them through. Again, I speak subject to correction. I don't know how readily available it is, but we should have stocks of that available as well, because no one can quite predict the extent. Is this going to spread as widely as Omicron did? And if it does, one thing is for sure, it is more transmissible.
Right.
Once it's more transmissible, more people are going to get affected. And if you get the greater the number of people you get affected, the greater the number who are going to reach to hospitalization.
Let's break down keep the conversation simple. We talk about the transmissibility factors. Let's take that in layman's term for some individual that's home and probably trying to make sense of saying, I've heard this conversation already, here we go again. In terms of the transmissibility factors, exactly what are those factors and how, the fact that it is much more easily transmissible. What are we talking about?
We are saying that the viral particles are there in the air, but it is actually thought that this virus has a greater ability to bind on to the cells.
Right.
And to bind on to the cells. Sorry, let me turn off this phone, I forgot.
So it's 11 minutes gone past the hour. I just want to say thanks to those of you that's just joined in the conversation. My guests this morning, and to the point, Dr. Bert Braithwaite and Lady Ann David Añtoine. And the conversation this morning surrounds that issue of COVID.
Yeah. So sorry, I was saying this virus will bind to the cells faster and more aggressively. Once it does that, obviously it can penetrate and get into the system. So there are some viruses, when they're out there, you can catch them, but your propensity to catch them will be less because of how the virus is behaving. This virus is behaving. It will get into the system faster. It will get into the system faster. And the thing is that probably it's not bringing as much in the way of respiratory complaints, and this is something people must be aware of. A lot of people are getting muscle aches, bad muscle aches, and they get fevers, bad muscle aches, they get the sore throat, but they don't get as much upper respiratory tract symptoms, but still you would think there was, and they feel very weak. They feel very, very weak. So if people get those symptoms, they should go and get checked to see if it's COVID, and therefore know to keep away from vulnerable. Well, stay at home until that window period is over, and stay away from the vulnerable in the household.
If I could just add something here. I think there are two things about the transmissibility. One really has to do with how the virus behaves. The second really has to do with how we as individuals behave.
Okay.
Because we as individuals may not be taking the necessary precautions. The things that we've been doing before, washing your hands, using sanitizers, if you're coughing, sneezing, if you have any kinds of symptoms, to keep your distance from people who are vulnerable, from other people, from when you're in groups and those things. So it has to do with the individual as well as with the virus.
And very often, the conversation of human behavior, that's the most difficult one to tame. And we can always institute policy, say don't do this, don't do that. The question of how do you now manage, not just institute policies, but how do you get persons to manage the way they behave, we behave? That becomes another conversation. But having gone through COVID-19, what have we learned? First, from an administrative level, I'm not talking about who is in power, but what have we learned honestly? Let's start from the medical side. If you can, Dr. Bert, and then Mr. Añtoine, we probably talk from an administrative perspective. What have we learned from the last 3 years?
Before we go into what we learned, I just want to make a point because I don't want that to slip us. The use of masks, very important. I don't have it on here because I want my voice to travel clearly, but technically speaking, I should have this on.
And you can feel free if ever you wish. Feel free.
I take a chance.
I have no issues with that. You can feel free.
But so wearing of masks and not cloth masks. Cloth masks are very ineffective. They have to be actually KN95 masks, and it's about where you're going to be wearing them. Supermarkets, pharmacies, any place that you have crowds, that's in any place indoors that you have crowds, that's where you should be wearing masks. And I encourage folk to get back into the mask in these type of settings to decrease this part of the virus. Now, with respect to lessons,
and that would probably be a good backdrop to get into the issue of what have we learned, because you have the issue of the wearing of the mask and those things. I mean, those are messages that were preached. I mean, morning, noon, and night, and there were still elements of the public who just seemed to
but you know what is interesting? What is interesting? Go on any of the cable channels and you watch in many of the Far Eastern countries, even outside of COVID, these folk, because they're much more populous, actually walk around masks outdoors quite often.
Yes.
Right? And I'm sensing that if indeed, in fact, COVID continues to linger on, that we are going to have to follow that example in many respects. But in terms of the lessons learned, it's first and foremost, you've got to be prepared. Going through COVID was like any emergency campaign when you have NADMA tuning in for a hurricane. That is the way it came on. You know, our memory is short and we tend to forget a lot of what has happened, but it was a tremendous challenge. Now the blueprint is laid as to how you can go about it, and we need to do a reflection, and some countries have done that. They've gone back and they've looked at what they did right, what they did wrong, so that their plans, that you have a plan there, because the world is telling you this is not going to be the last pandemic that we face. Right. There are going to be others. And as we said, COVID is lingering on. So you have to have your team already there, knowing what they have to do, knowing what the resources you have to tap in on. You have to have reserves of certain like things like masks, for argument's sake, and alcohol we have that in abundance here. So that's one thing we do suffer from, the sterilization solution.
I'm just laughing. Yeah. I'm sure other folks are smiling because they're probably thinking, Doc, I ain't wasting my good substance for that. It might just be interested how people may actually perceive it. So there is that, and you said there is a blueprint, which David makes it easy for this current dispensation. God forbid that we find ourselves in a position where we have to lay out some of those public health policies. You know, because even if I say sort of blow our trumpet a bit, up until August of 2021, we had done exceedingly well. And overall, we did very well still. But up until August, we just had 2 deaths, and people were amazed. And I can say, last night the Prime Minister was mentioning what was happening in the Ministry of Health, and suggested that there wasn't much activity. But what I can tell you, I don't know what was happening within in the belly of the organ, but I know from my contact with the Minister, from my contact with the senior officials within the Ministry of Health, they work round the clock. As a matter of fact, on more than one occasion, I had to praise them. I had to say,
how y'all manage this? I mean, they was like, they were making more than 24 hours in a day, because through the night, through the day, it was a constant meetings, and you've got to be prepared and have mechanisms set up for that. And the past government took the country very well through that period until we decided to do our own thing, and we played our job, and things went well. We encouraged people. Now that type of thing, that type of negative approach, from some quarters, from some political quarters, they encouraged people to go play a job. And before you knew it, we knew Delta was coming on the road. We were trying to warn for, and what happened? Within the space of 8 weeks, we had 198 deaths. Right? Mainly unvaccinated people.
Some have argued, though, and because there's always varied point of views, conspiracy theories, fearmongers, social media, misinformation, and all these sort of things that some have argued that help to create that quagmire of uncertainty. Some have argued that one of the challenge was, at varied levels, our inability to communicate quite clearly to the masses what exactly the message should be. Should it be one of fear? Should it be one of reassurance? Or will we just be honest and say to individuals, these are the options that are available?
Well, I think it should really be a mixture of all three. But it's fighting social media is really a challenge. I mean, you're in the business, so you would know that. It is really, really difficult. And messages are put out by people, some obviously not locally, but otherwise, and people may not know which messages are correct, which are not, which are put out by people who really do have no idea what they're talking about. But in addition to the messages about how to behave when there is a threat of an infection or any sort of thing of that nature, the other thing that we have learned, I think, from COVID is how to encourage people to come forward and volunteer in times of need. There were lots of people who are out there, whether from students from the medical school, local students, nursing staff, other people in the general community who offer their services many, many times at all hours of the day and night to help to fight this terrible disease and this scourge. One of the other things I think we have learned is how to communicate and how to have access to people in the diaspora who would be supportive of the needs of a country when something of that happens. So I sincerely hope that those things are being kept on file somewhere at this time and are available at the touch of a button to be able to reach those people. I know also that our people who are ambassadors and so on in the various countries, the United States, Canada, United Kingdom, and so on, they gave yeoman service at that time in order to be able to help us in Grenada to overcome that challenge.
And we made strides, because as you said, I mean, in all honesty, notwithstanding which side of the political fence we sit, or you stand, or you're running around, because some people, they do things for different reasons. We have to agree that for the first half of that epidemic, we were fine, relatively, in terms of our comfort level, what was happening at the administrative level, on the ground. I mean, certainly. And some of the arguments you hinted to, Doc, from one moment of madness, when we literally just turn the tables, we turn the tables around. With all of those challenges, though, and that continued, and it's out there, people, we tell us, okay, we open back the borders, we are free to live our life. It's not the first time we've heard of an outbreak. We've had other chikungunya, which we were told is going to be here for quite a while. We had all these different things, Doc, and we keep being told the same thing. Do you think that adds to that mental saturation where persons are thinking, you know what, I've had enough? And while that might be so, could that then create a challenge for our healthcare system in terms of how people are able to cope with Doc, mentally? If, God forbid, there should be another outbreak.
Yes, undoubtedly. So it's a tough ride. I mean, what people are called to do, it doesn't come. You can't socialize. You're inside your house for a number of days. There are some weeks I left my house once or twice. right? I mean, once or twice,
Right.
somebody said, you know, your car doesn't leave your house, type of thing. But so it's, yes, but one has to look always at the circumstances. What are the consequences? When I go there, and I was obviously affected the young, well, affect every population group, because even the elderly who were going to church and couldn't get out to the church services, etc., they felt very affected. But more especially the younger folk who are much more energetic, etc. But life is such that if you are faced with a challenge, if you are faced with a challenge with a very infectious bug coming around, and what you always have to watch is what is happening in the hospitals.
Right.
If you get a lot of hospitalizations and you're getting deaths, you've got to start to institute measures, be it popular or not, to try to limit the spread and not to be overwhelmed. Our system was stressed to the max, as Mrs. Añtoine pointed out here. We got help from outside came in, and we were able to rise through it. But it stretched every health worker, the nurses, the technicians in the lab, the biomedical people, you know, the whole range, the ambulance folk. The ambulances were just coming up and down, bringing those ferritin individuals to hospital, many of whom didn't survive.
I think also there's another aspect that we really have to look at. The practical aspects of being ill, not being able to breathe, thinking you're going to die, and all of those things. But when you think about the effects that COVID had on the education system, on our children in school, the psychological health of everyone, including Dr. Braithwaite and myself and you, I'm sure, because we constrict. You have to be inside, you have to do this, you have to do that, you're not able to. And a lot of people, those effects are lingering, and we really do not know how long those effects are going to last. Some of the things we probably are seeing now, which really has to do with the kind of behavior that we see where people seem to have what we'd call, they're on a short fuse all the time. All of those things are probably things, and psychologists are saying this, that are kind of layovers from the effects of COVID.
No, the financial impact.
And the financial
impact on many homes. Mark you, the government set up many mechanisms to try to make sure that, you know, nobody went without a plate of food, and that they could still service the basic needs.
Right.
But, yes, but still people didn't have, you know, the plans would have had to be mothballed until, you know, things would ease up.
Interesting conversation. 27 minutes gone past the hour in the morning time. While we at it, there's a contributor on social media. And let me just make sure I get this on before we take the break. It says, my brother would like to donate some dialysis tubes to the General Hospital and would like to contact one of the doctors on the show to send a sample and a test to see if it is comparable. And I think we hinted to that, that the only way we can navigate our way through this is an all hands on deck approach. It doesn't matter what sphere, what religious background, whether you're here, you're in the diaspora. It means each and every one of us as Grenadians, there must be an awakening of our consciousness and of our need to survive. We'll take a quick commercial break. When we come back, we'll open up the lines and we continue the conversation with Mrs. Ann David Añtoine and Dr. Bert Braithwaite right here on To The Point for today, the 10th day of the month of January.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing.
But hope is remaining.
And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para cortar la humanidad. And I must leave no one behind because we are. One climate, one Caribbean. One climate, one Caribbean.
things you need to know about self-isolation. Stay home. If you are told to self-isolate, it means staying at home, not going to work, school, or other public places, and you should not have any visitors. Separate yourself. If you live with others, then you need to stay in a well-ventilated bedroom with the door shut. If you have to share a bathroom, then use it after everyone else. Don't share towels and toiletries, as this may put others at risk. Call ahead. If you develop symptoms such as a fever or cough, then seek advice first by calling the Ministry of Health's hotline at 538-4787 or 458-4787. Please do not show up at a medical center or hospital, as this may put others at risk. Take care with waste. If you test positive, your waste should be double bagged and disposed of separately. Create a buddy system. If you live on your own, you can plan with friends and family to check in with each other and run essential errands if one becomes sick. Once sick, they should leave groceries on the doorstep. Why it's important. COVID-19 causes a mild illness for 4 out of 5 persons. Self-isolating will help protect the older generation and those who may have underlying health problems from getting infected.
You know, one day I woke up and, they painted a set of pedestrian crossing all along the streets. Nobody told us how to use that thing properly.
I know how.
You're serious?
Every safe, good driver knows about these things. As a driver, you have to be very attentive. You know you're coming up close to a pedestrian cross, you start slowing down immediately, looking to see if there's any pedestrian on the side getting ready to cross. If there is, you stop on the line that is a certain distance before the crosswalk. Then you would see the pedestrian put their hands out, looking directly at you, indicating that they are going to cross. And only when you have come to a complete stop, that is when they will quickly and safely cross to the other side. And then you continue happily on your journey.
Stop, look, hand out, eye contact, wait for pedestrian to cross. Then you happily continue on your journey.
This message is brought to you by this group of insurance companies, the Traffic Advisory Body, and the Traffic Department.
Thank you. Welcome back. 29 minutes on to the hour of 10 o'clock in the morning time. This is to the point for today, the 10th day of the month of January. My guests this morning, Dr. Bert Braithwaite and Mrs. Ann David Añtoine, and here's representatives of the National Democrat the New National Party. But certainly we're discussing a conversation that goes beyond political rebs. As it relates to COVID. We do have a caller that is on the line, though, and we just engage that caller. Good morning, caller. You are live.
Good morning.
Yes, go ahead, please. You're live.
Yeah, good morning.
Good morning. Good morning.
Good morning. Can I ask you nicely if we could turn down the device that is in the background and we conduct the conversation via the telephone, please?
Yeah, well, I have done so.
Yes, go ahead. You are live.
Right. Okay. I want to ask the Dr. Braithwaite that in March 2021, or just about that time, we got some vaccine, and by April, May, it had expired. It had an expiry date, I think, up to April, end of May. Now, since then, for example, the whole of 2022, we are asking people to keep on taking the vaccine. I would like to know that this vaccine, where it was kept, how it was kept, and what the expiry date is, or what's the expiry date. So I am concerned that we're asking people to take vaccine that are expired. I'm also concerned how we detect for example, somebody have COVID. We're asking people to come and check. How do we test that they have COVID by a test kit, which we had for almost a year or more than a year, more than a year, which I assumed has been expired. Because most of the times we talk about we gain false information from social media and so on. But I could recall in 2021, India had sent back all the test kits that was made in China because they was expired or they were no good. So if we testing to determine if somebody have COVID by our test kits, that they wouldn't tell us where it came from, they wouldn't tell us how long it's been around, they wouldn't tell us where it's been kept. How we know that we are being tested with proper software, proper medical kit?
Okay, caller, thank you. Appreciate the question.
Sir, I would like to reassure you, the immunization department in the Ministry of Health, I know a number of the nurses there, and they are some of the finest, and indeed, some of them got national awards for their service during this period. They work their butt out. They are not going to give vaccines to individuals. No professional person is going to go and give a vaccine to an individual if it is expired. Right. So the expiry dates that will be placed often is on each vial and on each block unit that you have. Those units are kept under strict conditions. I had a flu vaccine recently from a stock, and I saw they were being kept in the fridge, and that fridge is monitored to make sure that temperature is there throughout. So the question of getting, and yes, there would be vaccines you would, once you bring a stock of things and people don't utilize them, they will come near expiry date, and then they would have been destroyed. That was the practice then, and I'm sure it will continue to be the practice now, because I have the greatest confidence in the health profession. So you can be reassured about that. They're not going to give vaccines that are expired to anyone. And especially with all the hype that has gone on social media, the huge pushback that social media has created against something that has saved so many millions of lives. And globally.
Thank you, Doc.
How are you doing?
We have a caller. Good morning, caller. You're live. Go ahead, please.
Good morning, dear. I'm just ringing up to ask you about the boosters, because I've had a booster, but are we going to be allowed to do a second booster or a third booster when you're older, when you're over 70 or 75? That's the question I'm asking. And medical stations or your doctor, or where do you go? Because there's not much information about this, really. And that's what I'm querying, really. And good morning, Mrs. Añtoine, and good morning, Dr. Braithwaite. Happy New Year, dear. Bye-bye.
Good morning, and thank you, and Happy New Year to you. Let me just start this one by saying we've both had boosters. In actual fact, I've had 4 vaccines now, because I've had 2 boosters. And the immunization department of the Ministry of Health, they are always ready, willing, and able. Your general practitioner, the chief medical officer, and anyone up at the hospital who is working there as a doctor or a nurse will direct you accordingly, and your nearest health center or medical station. From your point of view, because since you've addressed me, I know who you are, your nearest one would be the health center in St. George.
Let me ask, though, just to piggyback off of the concern from a previous caller, the best practices as it relates to how we to treat and the storage of medication, that's not something that is specific just to the COVID vaccine. It's specific to all other medications that we find within the healthcare system.
But you have to be that much more careful about the vaccines. They have to. They come in a chain. They cannot come in and be left on the port somewhere. They come in under specific guided temperature, and especially the Pfizer vaccine originally had to be kept at very, very specific temperatures. So every effort had to be to ensure that continues.
I made the point, just to reinforce what you said, that this is not something that's been done ad hoc by people off the street. These are professionals, trained professionals that have been doing this for years. Outside of COVID, they treat and administer vaccines and other medications, and they understand more than ever, not just your life, but their profession depends on them being able to appreciate the conditions under which you have to operate.
And one of the things is that everyone in the health field would be concerned about is that because of the pushback against vaccines, it has affected I'm not sure what our numbers are here now, but in many countries, the infant immunization campaigns have suffered, and they expect outbreaks of measles, etc. And these are dangerous childhood diseases. So I encourage parents to go up and follow the guidelines. You see, I come from a generation where, I've said this before publicly, I saw on the wards in Mona Hospital, the hospital in Jamaica, the University Hospital, I saw many of these childhood illnesses, grievously affect children, kill many children. But we have reached a stage where many young doctors would not have seen some individuals with the complications of rubella and mumps and rubella and measles and tetanus, etc.
We have a caller on the line. Good morning, you're live.
Hi, good morning. Hello.
Go ahead, you're live.
Yes, this is my first time I'll be calling, but I just called to say special thanks to Minister Steele when he was a minister. I mean, he worked very well. I remember I get COVID, and I went twice and get tested in Foodland, and they had to attend there. And I saw him with them. Nurses and them, and how he worked with them. I mean, I had to go to him. So I just say thanks to him and thanks to all the group, all the work together, and they had a good team together. May God bless them.
Thank you.
Them.
If I can just add one more point to do with the monitoring of vaccines and all vaccines, including COVID vaccine. The international and regional organizations like CAFR and so, they of course have to support the work that is being done, and they have had their eyes on all of this work that's been going on. So the nurses, of course, they always get 100% because they've been awarded, as has been said many times. But that level, second level of monitoring can reassure all of us that we are in safe hands.
The initial conversation surrounded that of the administration of the drug, COVID-19 drug, and the conversation around herd immunity. And there are different schools of thoughts as to which one works. But the question of herd immunity, is that a conversation, sir, lady, that is a justifiable one? And can we also add into the conversation, or should we introduce into the conversation our dietary habits in terms of what we consume? Like I remember during the COVID, they're telling you, go and buy zinc, go buy zinc. But doctor always telling you to go drink, to go get some ginger.
Yeah.
Go get this, go get this. They don't tell you go get some turmeric.
Yeah, well, listen, a lot of those things, and the one that I was most upset about was ivermectin.
That one was a firestorm.
And ivermectin, I suspect, might have caused some people to lose their lives because there's been absolutely no proof that ivermectin ever worked. And the science was pointing in that direction, but some people chose to follow what they were seeing on social media. Social media can be very dangerous in that you have to go to reputable sites and sources for your information. Just don't take up anything that John Public says and accept it. Yeah, so, those are some of the battles.
But do you think that whatever campaign is rolled out should, in fact, level the playing field a bit more for persons who may well be convinced, and for whatever reason, that, listen, what you're asking me to take in a vial, I can get the same immunity through my local products?
Oh, yeah. No, by all means, always support the use of your local products first and foremost. And there's nothing wrong with, and there's probably some goodness in having you add zinc to your regime. Again, be careful, because if you're going overload with zinc, you can run into problems. There can be complications. So,
while you're at that, Doc, for instance, and I'm asking you because those are the things we grew up. Listen, we have those things readily available to us, and we just use. And as I'm saying, to me, I think what can be a pivotal point is information or lack of thereof. People, if you give people information, so for instance, if I consume too much zinc, which I can get from my ginger, right? What could be the drawback?
Not usually from products like that will run into problems, but it's when you're taking high dose, concentrated amongst in tablet form, but not from your ginger and things like that, or any natural product. The natural products are by and large pretty safe. I think they're overrated sometimes in terms of what they can do, but they are a necessary part, and I'm all for the question of having a balanced diet is critical to our health and well-being generally. Yeah. So and it brings it into discussion the whole question of when you go to going and buying refined foods, these refined foods that you get in the supermarket. If we could get our populations back to using the ground provisions, the yam, the potato, the dasheen, but we prefer to go, well, in some cases, these are things that are not as simple as that, because sometimes people will tell you it's cheaper to buy the refined product overall. So what any government has to do is to try to find ways and means to make sure that these things can come to the consumer at lower level, sorry, at a level at a cost that is competitive with the other products that are brought in the supermarket.
I think that is one of the items. Just yesterday, I was saying that we went to the supermarket, you bought a hand of fig for $5.
Yeah.
9 grain of bananas, $5.
Yeah.
So if you're going to play the balancing act economically, you have a family of 4, right? And you have to decide, green bananas, healthy, or do I buy 2 pounds of rice and still get to buy a small tin of corned beef to feed my family?
Yeah.
Naturally, we can see where the conversation is going to lead.
Well, that is a situation from the economic standpoint that, of course, the government has to be looking at. And as you have rightly said, from the New National Party standpoint, and obviously from our professional life, we are prepared to help and to support anything along that line. In the same way that we are prepared to help and support, and we want to strongly encourage the health minister and his team at the moment in the fight to roll out the information, to acquire the vaccines, to make them available, and to encourage people to do what is right and what is correct for them. One, to have the vaccines available, not just available, but accessible to people. Because it's one thing to have things available, they're not accessible to people. And the second one is to encourage people, what are the correct things to boost their immunity, so that psychologically, emotionally, physically, and everything else, they can have the protection necessary.
We have another caller on the line. We lost the caller. 435-2041. That is the number on the inside. I keep saying that as a country, COVID provided us with a golden opportunity to change a lot of things. There's been the ongoing conversation of food security. Grow what you eat what you grow. And I think COVID, as it is, provided us the ideal opportunity, because people at that point in time were willing. At some point, you were home, you had nothing to do, and do you think that we missed a golden opportunity as a country? And I'm talking about no one political organization, but we missed an opportunity whereby we could have done a 180 in terms of how we treat with the whole idea of eating local.
But I think that was strongly encouraged. But don't forget, for a period of time, people were restricted. If you had your land in Birch Grove, for example, and you lived in St. Mark's,
right,
there was that difficulty of travel, of transport, getting on a bus, being afraid, what have you. Yes, you may have been able to do something small, but the plans would have been laid, and they were laid, and they have been laid, and they are there present, so that now they can be enhanced and put out there so that it can be. So
we are hoping that there is a continuum of that which is already laid, established.
Right, but many people, the ones who are fortunate enough to have a plot of land behind them, they started to do some planting, because you can do a lot of backyard. And the thrust now should be for people to continue that. Mm-hmm. But it is easier often to go and pick up something. And a lot of these items that you get in these plastic containers, they can't compare in terms of food value.
But you have to
right?
agree, though, Doc, but we hold the point because we have a caller. Good morning, caller. You are live.
Yes, good morning.
Yes, go ahead, please.
Yes, there was so much work done in the health system. And presently, in a few months' time, the health system is on its back. Explain that for me, please. Thank you.
Hello, caller.
Hello.
Can you just offer some meat to the comment that you just made?
I think what
Yes, I can come back. I can come back. What I'm saying is there was so much work because in the introduction with your guests, they made it appear that there was so much done in the health service. And what I'm saying is, if there was so much done in the health service, within a matter of months, the health service is on its back. So that means the health service was on its back long before. That's the point I'm making. Thank you.
Okay,
yeah. I would never say to you that we did not have problems in the health service, and anyone considering the quality of service delivered, etc., the personnel problems, these are well-known problems. But what we can say is that the folk worked tooth and nail through that COVID epidemic. From the minister, one of the caller came in, the minister led that team and he multitasked in a way that I don't know how he got it done. No, are there problems? Did the New National Party leave problems in the health system? Yes, there would have been. There are problems in the health system that need to be worked on, but there were attempts to correct them, and these are historical problems. I've been associated with the health system here, 30 plus years, and constantly in either at a ministry level, hospital level, wherever I was, and even when I was outside of the system, working and trying to put in my 2 cents worth to help. And there are some serious challenging problems. There's no doubt about that. But that what the previous government would have been doing is trying to deliver in the best way possible with the resources that they had available.
Do you get the sense, Doc, because you talk about your interaction, you're being part of the system for more than 30 plus years. Do you get the sense that one of the challenge is that we politicize everything, and there isn't continuum of government, that we seem to forget that. So one administration comes in, there's an excellent plan. So for instance, you've had conversations about health insurance, national insurance, the hospital, and all of these different things. And every time an administration changes, it seems to become a talking point, but nothing happens because somebody's going to be blaming somebody's blaming the other person. But the conversation should be that of whatever agenda it is set, it should be one that's premised on national interest, not that of who gets the feather in the cap.
Well, I certainly agree with you, the politicizing of the health system as of some other systems. But with health, it's always much more obvious. But I would just like to state now some of the positive things that were done. You have mentioned national health insurance, a plan that was laid for national health insurance, and I'm glad to hear that maybe that is one of the ones that this present administration will be continuing. And of course, we are ready and able, I would say, to support that. But you've had a new hospital built over the time. They have just moved into that hospital. We've had X-ray machines over a printed house, a new wing put up. We've had the kitchen, which provides, of course, food and so forth, the tents. We've had a number of health facilities, for example, the Richmond Home and so. They have all been retrofitted. All of that has been done. All of that costs money. There's been a lot of training of staff, and not just nurses, but other staff throughout the system. You've had vaccines to bring in. You've had all kinds of other medication. You've had dialysis brought in over those years by the past administration. There's been a lot of, CT scans and all of those.
Top level.
Yes. Top level. Dr. Braithwaite is reminding me of so many things have been done that it's difficult to have them all of pat. But people who have been in the system and who have been the beneficiaries of those systems will tell you there was a very well laid plan for a cancer program in Grenada. And really, I can tell you that is one of the things that makes me really, really sad about
When you
the
say
system.
the plan that existed when and what has happened to that plan?
Right, a plan that existed way back in between 2004 and 2008, thereabouts. Financing was made available by a friendly government. Support in the form of personnel was given. People gave their voluntary services. A number of people who were suffering with cancer at the time would tell you that they were beneficiaries of the system. After that, we were at the point had been reached where there was need to actually go out into the homes to people and have what you would call a home service for people who were suffering with pain and were perhaps in the later stages of cancer, to support their families and all of that. And unfortunately, a new administration came in and that was not continued.
But let me ask, though, because I very often I hear these arguments, and I'm one. I always stay down the middle. Down. I stay down the middle as to whether or not that is in fact a viable reason why things are not being done. And I think therein lies the concern that I have. So you go back to the period 2004, 2008, when the administration changed. They spent one term, and then the previous administration went back for another back-to-back terms. But yet, the very plan that was in the kitty just to be rolled out, it wasn't attended to.
Yeah,
But it cannot be rolled out when the money is no longer available for that particular, because things like cancer and so cost a lot of money, and you depend on outside sources to help you. And so many other things are coming on. And don't forget, within that time, we've had hurricanes, we've had COVID, and many other conditions.
Yeah, the NIS, they work a lot of work, and both of us actually sat on NIS committees, and a lot of work. Sorry, not NIS, National Health Service, NHS.
And that is one that seems to be
right.
Yeah,
a lot of work was being done. Fortunately, as was said, the government has decided to continue with the same person. But do you know what happened? For 2 years, basically, that program halted. We were meeting perhaps on a fortnightly basis to look at various aspects, trying to build it up. And almost certainly without COVID's present, there would have been some introduction of a national health service system. But COVID came along, and it's in a sense, it is easy for us now to sit back and say, well, look, this hasn't been done for this time for time. But for nearly 3 years, and the majority of the period of the last government, all focus from a health point of view, or most focus from a health point of view, was on COVID. There were other programs such as the attempt to bring technology to bear in the medical side, both in terms of record keeping, in terms of setting up facilities that would allow you to stay from, you could get a specialist in the United States. One of the things that we face is shortage of the professional people. We have trained many professional people, but at least with telemedicine now, you might be able to do an echocardiogram and have an expert from the United States comment on it. There are a lot of services you can provide, and that is those things were in training to get those type of processes going.
And I understand, and it's going to be interesting, but we almost out of time. But there are those who would argue that if you were to weigh, you play the game of one administration being in power against the other, some would argue that it doesn't quite add up. If you look at the total amount of years, notwithstanding this current dispensation, how there has been, all the different years, there's been, 10 years? So there's the Nicholas Bradford period, there's 2008 to 2012, right? There's that period. But you look in terms of how long the NNP has been in power. Some would argue, quite reasonably, that while, yes, there were challenges and disruptions, some would argue that the plans that you had more than enough time to at least say, this in the healthcare is one of our premier achievements that we can all say as Grenadians 20 years from now, when you probably would have You're probably
Go on the
sitting
other
back.
side.
You know,
Go on the other
I didn't want to say that. I didn't want to say that. But you're probably retired from it. You're back in your rocking chair, sipping a martini with some orange juice in the morning time, and we can say, you know what, we have done well. We have done well. But we're almost out of time though. But I'm going to give each of you a minute just to put the icing on the cake onto this conversation.
But if I may, I would say really that you have answered the question, because I clearly stated a number of things that were done over that time. Buildings, building people, looking at the psychological effect, psychiatric.
Well, yes,
and all
buildings,
of those, yes.
but I think ultimately buildings
Yeah,
is
but
one thing. But sometimes the fundamentals remain untouched.
No, you must have infrastructure. You can't treat somebody in the street if there's a medical condition that requires hospitalization. There's also been the service where people can be seen in medical stations, which is public health and all of those issues. But we have to, if you look at it, you will see the amount. And when something has been erased and been completely wiped out, you have to actually start from scratch again.
Fair enough.
Yes? So
Fair
that
enough.
is it. Can I just quickly, before we finish
Yes.
off, I want to just take 1 minute just to offer our condolences from the New National Party to the young student who actually passed away in Cuba very recently. I had interactions with him, so I do know him, and it's a very sad time for the medical and the health profession, as well as to his family and friends. Thank you.
Indeed. Doc?
Yes, I just would like us, from the primary healthcare point of view, I think we hold our own and we are on par with many other parts of the region. Not to say there's a need for upgrading of facilities, etc., etc. Our main problem has been from a hospital point of view. Those challenges we try to confront, and mechanisms are in place and there have been improvements. If you go and look at the new wing there, it looks like a state-of-the-art facility in many ways. So there have been things that we would have loved infinitely more to be done. But the personal issues and the whole structure of the system that we operate within, that is where the pushback has come from.
I think I probably just want to learn from one of our old Calypsonians. We've come a long way, but there's so much more that can be done. I think the hope is that the issue of healthcare or advancement as a society, it is one that is predicated on wanting to serve and not necessarily for political accolade. I think very often, I'm being honest, that's where the grey lines it comes in. But certainly, I think we have to appreciate who we are and what we have achieved as a nation. Some things we take for granted. For years, the ability just to go into the hospital. And I know in recent time we started paying for services anyway. Nobody ever asked for years. Who covers it? I have to say there's nothing as a free lunch. Nothing as a free lunch. Somebody pays for it in the background. But my dear Sir Lady and David Añtoine and Dr. Bert Braithwaite, my dear friend, really want to appreciate it and say to you that COVID-19 is an ever-constant challenge to us that has pervaded us in so many aspects of our lives. And I'm certainly hope that each and every one of us will take an introspective look as to what we have done, what we are doing, and what we can do to deal with the challenges that COVID-19 presents to us as families, individuals, societies, a country, and the world at large. From all of us here at the GBN, your boy JC saying peace and love. Have yourself a wonderful Tuesday. God bless.
Bye.